This is Alex Holbrook with my second community health education project. Obesity in children, associated health risks and prevention strategies. For this presentation, the learning objectives are as follows. First objective, define obesity. Second objective, identify possible risk factors for childhood obesity. Third objective, identify possible health issues related to obesity. Fourth objective, identify lifestyle changes that can promote weight loss. 5. Identify strategies for treating childhood obesity and promoting overall health and wellness. Before we begin, please click the link below and complete the pre-test. After you have completed the test, please resume the presentation. There will be another test following the presentation. Childhood obesity is defined as increased body weight and accumulations of excess body fat. Childhood obesity can affect any ethnicity or gender. This can also be related to certain medical conditions or lifestyle choices. According to the CDC, childhood obesity is defined as having a BMI greater than or equal to the 95th percentile for that particular age group. Childhood obesity has been a continuing issue in the United States and also throughout the world. According to the CDC, children ages 2 to 5, 13.4% are considered obese. Ages 6 to 11, 20.3% are considered obese. And finally, ages 12 through 19, 21.2% of children are considered obese in 2017 and 2018. Risk factors for childhood obesity. The number one risk factor for childhood obesity is lifestyle choices. That can include a sedentary lifestyle, which can include watching excess television, playing video games, or computer browsing. Also, poor diet, which constitutes excess calorie intake, fast food consumption, and simple sugars, can also contribute to this. This combined with children playing excessive video games and watching television increases body fat and contributes to childhood obesity. In addition to sedentary lifestyle, a lack of exercise can also contribute. There are also socioeconomic factors that can contribute to childhood obesity. For example, lower income families are more susceptible to childhood obesity due to seeking cheaper, calorie-dense food choices. Also, family history can contribute to childhood obesity. Children that come from a larger family are more likely to end up as a larger child. There are also a few medical conditions not related to lifestyle factors, which can include hypothyroidism and Prader-Willi syndrome. There are also psychological factors to consider, such as stress eating and binge eating. Health risk associated with obesity. As with adult obesity, there are many negative health effects associated with childhood obesity. If left untreated, these children could develop several health problems that will extend into adulthood. A larger child is likely to become a larger adult if nothing is done to correct the issue. There are several possible health conditions that can be associated with childhood obesity. For example, children that are obese are more likely to develop type 2 diabetes due to an increased insulin resistance. They are also going to be prone to cardiovascular disease. Increases of LDL cholesterol, also known as bad cholesterol, increases this risk. This is associated with high saturated fat content in their diet. Hypertension can make this even worse by increasing the child's blood pressure. This can also result in joint pain and inflammation due to the excess stress on joints from the increased weight of the child. This combined can also lead to depression or anxiety disorders. The child's image may lower their self-esteem, and they may be victims of bullying from their childhood peers due to their excess weight. There are many ways to help prevent or reverse excessive weight gain that is associated with obesity. Simply providing education to children will likely not be enough to create change. This is a sensitive issue that requires promoting healthy, lifelong behaviors and habits. First and foremost, changing the child's diet can be a huge help in preventing childhood obesity. By promoting a healthy diet and proper nutrition, children can maintain a healthy weight and not increase their BMI. To accomplish this, the child must have a balance of caloric intake and expenditure, meaning they need to burn off more calories than they consume. Excessive calorie intake without the corresponding expenditure leads to weight gain and increased fat. Teaching children about proper portions and what to eat can help improve their diet as well. Avoiding simple sugars and fast food can also contribute to a healthy diet, as simple sugars and fast food do not contain the adequate nutrition that is needed. And lastly, avoiding fad diets. There is no quick fix to weight loss. There is no magic diet that a child can use to lose weight very quickly. This includes the keto diet as is an example of a fad diet. Promoting exercise and physical activity can also help lower risk of obesity. Exercise combined with decreased caloric intake can help lower body weight, can also increase energy levels. In sports, formalized sports can help develop social skills amongst children. However, for severe cases, specialized exercise programs may be beneficial. For example, if a child is suffering from intense joint pain related to their excessive weight, they may need to use lower impact exercises. Community-based and school-based programs can also help children be active. The community can accomplish this by maintaining safe and clean playgrounds, basketball courts, and skate parks, if applicable. Parents and members of the community should also encourage active after-school activities, or activities that get kids out and allow them to exercise. In schools, sometimes a specialized physical education course can help children maintain a healthy weight. The most important prevention strategy would include leading by example, by parents and adults in the community taking care of their own weight and making healthier choices when it comes to diet and exercise will allow the children to see the benefits. Thank you for listening to this presentation. Please click the link below to take the post test.